My name is Jessica Wagers and I'm an ordinary Hoosier. I am an optometrist in Nashville, Indiana. I am married and I'm also a mother to a 2-year-old, and I've lived in Nashville my whole entire life. My dad grew up here as a child and my mom moved here when she was a junior in high school, and they have lived here since then as well. I actually was watching a documentary on people that make prosthetic eyes. And I thought it was fascinating because, you know, somebody that's lost their eye could have the appearance of having an eye, and the detail work and the artwork that went into intricately painting one of these prosthetic eyes was just intriguing. And it actually started when I was 7. That's what started the whole process of thinking about becoming an optometrist. I attended undergrad at Indiana University, and I graduated with a BS in biology and a minor in psychology and chemistry. And then I went to optometry at the Indiana University School of Optometry and graduated there in 2009. On a normal routine visit for just a basic eye exam, all patients are screened for refractive error. That's whether they need glasses or not. Also, health-wise, every patient is checked for cataracts, macular degeneration, and glaucoma, as well as other diseases like diabetes and hypertension. It's very important for patients to have regular eye checkups, whether they wear glasses or not. Many of the diseases that we check for sometimes have silent symptoms. For example, glaucoma, which actually is when the pressure in the eye is elevated and it could possibly cause damage to your side vision or your visual field. Lots of times patients don't even know that this is a risk for them or that they have this disease until they come and see an eye care provider. And so I often explain to my patients that this is a silent disease that is very detrimental if it's not treated or caught early enough. In diabetic patients, the small blood vessels that are often affected by diabetic neuropathy are also the same blood vessels that feed the eye itself. And so it's very important for a diabetic to have an eye exam every year in order to monitor for those changes in those small blood vessels, to make sure that they don't need treatment as far as laser treatment goes, to stop the leakage of blood vessels or new blood vessel growth, which can be damaging to the vision. As optometrists, we can see patients anywhere from 6 months and up. A lot of patients or a lot of parents don't quite understand how we do an eye exam when a patient is nonverbal, but there are lots of other ways that we can assess the health of a child's eye. We can actually tell where their prescription or their refractive error lies and whether that's normal for their age. And so in children it is very, very important to catch those kinds of high prescriptions at a very early age in order to ensure that their vision develops properly, especially throughout the school age years. The thing I love most about my job is working with patients, I didn't want to be a medical doctor because I feel like sometimes you're too rushed between patients. In my field, I do get one-on-one time, quality time with my patients, not just to talk about their eye health, but to make that connection with them as a person. Because at the end of the day, I'm still just a person like everybody else. And, it's rewarding to still help somebody to be able to see or, just make sure that they feel comfortable with maybe their disease that we're managing, or that they understand it fully versus just having a bunch of terms thrown at them. I want them to understand what we're talking about and what we're looking at every time we go over a test. Sometimes I feel like we come out of school and it's about, here's your glasses and here's your contacts, but yet it's much, much more to that. These are my patients, and I like that personal connection that I can have with them, and that I can sit down year after year and have a conversation with them about their family or their children. They ask about my child and how she's doing, and it's a friendship while they're getting their eyes examined as well. Why optometry? Because I wanted to help people in some way, and I felt like that was the best fit for me. I can help people see, and sight is an amazing thing. It's an amazing. We take for granted often the way we see or what we can see, and it's our life. We have to, we have everything we do involves our sight. As far as my inspiration to follow my dream, I would have to attribute that to both my parents. They have supported me 100% in everything I've chosen to do.